afternoon, and welcome to the Oley Kinser Concierge Wealth virtual education series. We are very much excited to bring you experts from a wide variety of industries to discuss how their businesses can help you stay healthy and plan for your future. We're always looking to provide value to our clients and friends beyond just the investment field.
To those of you who have joined us on this series, welcome back and thank you for being here. We appreciate your support and hope you have learned some valuable information along the way. For those of you who are new and may not recognize us, my name is Ryan Kinser. I am the co-founder and managing partner of our practice, which is Oley Kinser Concierge Wealth. Our team, based in Naples, Florida, partners with families, business owners, and retirees to show them better ways to grow and protect their wealth. We provide comprehensive financial plans for each of our clients, smart and professional money management, as well as exceptional service. Our team of 4 currently looks after 126 families across 16 states, and we have the capacity to partner with more of the right ones.
Thank you, Ryan. And my name is Brett Oley. I'm also a co-founder and a managing partner of our practice here, Oley Kinser Concierge Wealth, which is an independent practice of Raymond James. Ryan and I both have about 15 to 20 years each in the financial industry. That includes our schooling, both in undergrad and our MBAs. Between both of us, we have more than 6 designations as well. Our team's primary focus is to elevate our clients' experience in a big way and create true partnerships that they haven't experienced elsewhere. We love where we are and look forward to helping more families achieve their financial goals.
Thanks, Brett. And today, we would like to welcome Chris Melly, the CEO of Golden Care, as well as Adam Corcoran, the Director of Business Development at Golden Care.
Hello, gentlemen. Ryan, thank you for the introduction, and thank you to both of you for having us here today. We're honored to be here.
Hi, guys. Thank you again for having us. I greatly appreciate the opportunity. We're looking forward to the presentation.
Thank you for being here, Chris and Adam. Today, Chris and Adam will be reviewing the different types of home health care options that our parents or ourselves may be needing in the near future.
And I think health is clearly on the forefront of everyone's mind these days. And knowing your options, should you or a loved one fall ill, will provide you with peace of mind during what might be a stressful time. I'm looking forward to hearing more about this topic as much as our viewers are. Chris and Adam, can you tell us a little bit more about yourself and how you got into home care and home health?
Sure. I'll go ahead. I actually got started in the healthcare industry in large part because of my mother. My mom is an RN and has been in home health more specifically since actually before I was born. And back in high school, one summer, I remember getting a part-time job at the company she was working at the time. And one day I told her, I think we can do this. And that was 15 years ago. After high school, I went on and I got my bachelor's degree in accounting. And I told her, I can head up the business side of the business if you can handle the clinical side and bring that clinical expertise to us. And we started, and it's been a very interesting 15 years. The first company that we started was Preferred Care. That's our Medicare certified home health agency. And most recently, back in 2017, I started Golden Care as a sister company of Preferred Care. Golden Care is a private duty home care agency. And that's when I brought on Adam to our team to serve as the Director of Business Development.
That's right. So a little bit about myself. Again, my name's Adam Corcoran, and I'm blessed to be on the Golden Care team since 2017. So home health has been something in my blood for my entire life. I was raised in a family of nurses, and my mom was the director of nursing for a home care agency in New Jersey for all growing up, middle school, high school, through my college years. So when I look at my experiences in my schooling, I don't discount my college degree, but I will say I've learned a lot at the dinner table just from my mom and my grandmother, who were both clinicians. So when I looked at my career and my passion and really my purpose, what do I want to accomplish in my career? It's really to support and impact others. So when I had long conversations with my mom, I looked at my career, and I actually spent some time in the public school district teaching for a couple of years. And I also spent some time in the insurance world. And somehow I circled back to home health. So if you asked me 10 years ago if I thought I would be doing what I'm doing today, I'd probably tell you you're crazy. But I love what I do because I know each and every day we have the ability to impact and support others.
That's great. Thank you, Chris and Adam. And this information is so new to me. Can you help me understand really the difference between both home health and home care? And a second question, are these the only two options available to individuals?
Home health and home care are the two primary options available. You think by the wording of it that they would be very similar, but they're actually quite distinct, and there are distinct differences between both of them. I'll speak about home health, and then I'll let Adam discuss home care some. As far as home health goes, we provide skilled services. So when you think of skilled services, think of nursing care, therapy, whether it be physical therapy, occupational therapy, speech therapy, home health aid services, and even social worker services to assist patients with long-term planning and community resources. These services are typically used after a hospitalization or a stay at an inpatient facility, but they also can be used after a visit to the physician. If the physician deems that there's a change in status, the physician can write an order. And again, that's another difference between home health and home care. Home health does require a physician's order, but it is covered by Medicare and a lot of the private insurance plans. As far as the duration of the services, our visits are typically 45 minutes to an hour long, 2 to 3 times a week, perhaps more or less, depending on the clinical need of the patient. And we may be in the home for a couple weeks to a couple months, again, depending on the clinical need of the patient and what services they need to meet their healthcare needs.
And I'll address home care. So home care, also referred to as private duty, is considered to be non-medical in nature. So Chris highlighted on the importance of having clinical oversight in that home setting, whereas home care is non-medical. And it doesn't necessarily have to be doctor ordered or a script, right? Because at the end of the day, family or spouse or patient themselves is electing to having this additional support. We see a lot of benefits of home health and home care working side by side to ensure overall safety. Home care services could be hands-on support with help with in the shower, exercise support, help with dressing and toileting, or as simple as someone coming into the home environment and helping someone with grocery shopping and meal preparation, even laundry and light housekeeping. So these are all services that work in conjunction with that clinical care to be that overall comprehensive support.
Well, that's informative. And when would be the most appropriate time, Chris and Adam, for someone to engage in home health or home care services? And also, does one have to qualify? How does that work?
Simply put, home health or home care services are appropriate when an individual would benefit from having a second set of eyes in the home. It could be that someone, perhaps they're at risk for falling, or they need assistance with medication management, or even having support after a scheduled procedure like a total knee replacement. I'm a firm believer in being proactive and planning. I always tell people, if your physician detects unsteady gait, ask them if perhaps physical therapy would be beneficial. Let's get a physical therapist in there doing exercises to prevent any type of fall or other event that may result in some significant consequences.
And from the home care perspective, really it's not cookie cutter. So, there's a lot of scenarios that someone might have that additional level of support. So in home care, we see a lot of people who might elect to having some additional support if there is a diagnosis of dementia or any cognitive related diseases. And here specifically in Southwest Florida, we see that families are typically afar, right? The daughter and son live in Michigan or the Northeast, and they have mom and dad down here. And once they start to see things that might not seem right, maybe forgetting to take medications, not going to their doctor's appointments, or they're not eating properly, that's when they pick up the phone and say, okay, we want to have, as Chris said, an extra set of eyes, extra set of hands to provide that level of care. But really, it isn't cookie cutter. It's really specific to that person. Some people have family support and adequate care, and some people don't. So when we look at people, we really look at the opportunity of helping them understand to be proactive about planning for these situations, because we would much rather someone be prepared for these aging experiences rather than working in crisis matter.
That's excellent. I was also kind of curious myself, since home care services are not covered by Medicare or private insurance, how are they paid for?
Right. So as I mentioned, home care services are non-medical in nature. So what that means is Medicare and private insurances aren't traditionally going to cover this level of support. Home care services are typically privately paid. Okay, so we're seeing a average about home care services are charged by an hourly basis. So we see here in Southwest Florida that we're looking at probably mid-20s per hour. And on a national average, probably a couple dollars less, depending on where you live. However, there is support for people that opted into purchasing a long-term care insurance policy. Okay, I've taken the opportunity to really learn that industry inside and out to be able to help people understand what their benefits do cover. In a lot of situations, they do have policies that they purchased a long time ago. They just don't know when the most appropriate time to use it is. So we look at those opportunities to shrink those the out-of-pocket costs as much as possible. There's also some support through the VA aid and attendance benefit and other programs, but essentially your Medicare, original Medicare supplement, or any private insurance doesn't cover non-medical services.
That's great, and actually very, very helpful to know. I think one thing that may be on folks' minds are, kind of due to the current environment, how has coronavirus impacted your business? And then what, if anything, are you doing to ensure both the safety of patients as well as your employees?
The coronavirus, no doubt, has impacted our business as it has other businesses in other industries. Primarily, I think from a consumer standpoint, consumers are somewhat hesitant to let others in the home, thinking that healthcare providers that go into the home may bring the coronavirus or other infections or other diseases into their home, which parlays really well into the second question that you asked, which is what are we doing to protect our employees and our patients. And what we've really done is enhanced our infection control and quality procedures. We're doing ongoing education based on the latest CDC guidelines. We've ramped up our PPE supply, that's personal protective equipment. Our clinicians, every time they go into a patient's home, they put on a fresh set of PPE, gloves, masks, gown, and when they're done with that patient, they will dispose of all of that and make sure that they're not cross-contaminating and taking anything to another patient's home. Another thing that we've implemented is daily temperature checks for our staff. They have to take their temperature before going to see any patients in the morning. And if they have a fever or any signs and symptoms of any type of infection, they're to immediately notify the office and not see any patients.
Right, and in similar situations in the home care space, we're seeing the same precautions. We're very blessed, Chris, being able to get adequate supplies for all of our teams. And communication is a big thing. So every morning, as Chris mentioned, people are taking their temperatures to ensure that they are not symptomatic with fevers, but they also have to take a survey before they can even clock in for their shift. And what that means is they have to report if they've been exposed to anyone at any risk or if they're seeing symptoms themselves. So communicating with our employees and also our clients is a crucial part of the puzzle. Now, coronavirus ultimately has been an impact in our entire landscape. Now, some will say challenges, sure. and some opportunities, I would say, as well. And I'll give you a situation. We've looked at adapting technology into our processes to help streamline and deliver care in a timely manner. I'll give you for instance, we had a family down on Marco Island, and a husband and wife, and they had 6 kids combined that lived across the nation. So they ended up calling me, and typically when there's big families, the communication is a big part of the puzzle that we have to kind of figure out for them and help them understand the level of care that mom and dad need. So with this current environment, we're doing virtual Zoom and conference assessments to ensure that we understand what's a day in the life of that person. So we took the opportunity to get the entire family on one Zoom call, all 6 kids. Huge benefit to that because we were able to really set the stage for a successful start of care, and every single one of the family members was on the same page. They knew the expectations, and we rolled out care that next day. So with electronic signatures, the POAs were on the call. We were able to get things done much more timely than in normal circumstances. And the best thing about it was the communication was very clear. So I think, moving forward, although there's very trying times right now, and we understand that, but looking at the small positives of our aging population is adapting to technology. It's encouraging to hear, seniors that are familiar with Zoom or understand how to access these types of webinars for education purposes. So, I think the long term, being able to adapt to the technology will help streamline processes outside of the home care industry as well.
That's great. That's great, Chris and Adam. Thank you very much for that. And not only were you well prepared, you were really proactive, and I love the use of technology to really take great care of your patients. Brett and I want to thank you both for being here today with us. We found your information, very, very informative. If anyone has any additional questions for either Chris or Adam, please feel free to contact them with the information on your screen.
Thank you, gentlemen. It's been our pleasure.
Thanks again.
And again, thank you so much, Chris and Adam. And thank you also to our viewers who joined us today. I hope you can all join us next week when we host Dr. Udo Fisher with the Fisher Institute right here in Naples, Florida. He'll be providing us tips and tricks to stay focused during these distracting and more challenging times. To receive the link for that, please RSVP to Crystal Hoover. There's her email on the screen. And if you have friends and family that you think would enjoy this series as well, please certainly invite them. Take care and enjoy your day. Thank you so much.